Good afternoon everybody. So today I will discuss about stomach and its anatomy. So this is stomach, a outsketch diagram of the stomach. The stomach consists of a cardiac part. It is the cardiac notch of the stomach, a fundus. In between the cardiac and the fundus there is a cardiac notch that is at the gastroesophageal junction. So this is marked by cardiac sphincter. This is also as a cardiac sphincter. The fundus is the dome-shaped upper part of the stomach. Okay, above the cardiac notch, which levels at fifth intercostal space. So fundus is at fifth intercostal space, just below the nipple. So any gastric here, the gastric glands. There is gas production is there. So any type of acidity inside the stomach causes this gas formation, and it pressures in the fifth intercostal space and leading to a angina pectoris like pain. Okay, that is a cardiac pain because it is in the cardiac relation. Okay, now coming to the body. The body is the main part of the stomach where there is the food content is present, and all the digestions and absorptions of the food takes place in the body. Now there is a pylorus part. This is the lesser curvature, this is the greater curvature of the stomach. From the lesser curvature there is the incisura angularis, and in the greater curvature it is a sulcus intermedius. So there is a sulcus intermedius and there is a incisura angularis. There is a incisura angularis. So a line drawn and another line drawn horizontally to the greater curvature. So this part is the pyloric antrum. This is the pyloric canal, and this is the pylorus where the pyloric sphincter is present. So pyloric antrum is 3 inch. It is 3 inch in size. Okay, it is 3 inch in size. Pyloric canal is 1 inch in size. 1 inch. So it is 3 inch. It is 1 inch in size. Now inside the stomach there are rugosity. There are the mucus folds. There is some mucus fold in the longitudinal layer. So mucus folding longitudinal layer along the lesser curvature, and there is a irregular. So these mucus folds are the gastric fold, and there are some gastric pits. These are the gastric dot which we are seeing. These are the gastric pits where the gastric glands opened in the gastric pits. Okay. Now this is the gastric canal. Okay, so this is the gastric canal. So this is the gastric canal along the lesser curvature. So along the lesser curvature between the longitudinal fibers there lies the gastric canal where the liquid food pass. Now what is the relation? So the posterior relation. So there is a mnemonic. Dr. S3 kills patient mercilessly. So this is the mnemonic. So doctor means diaphragm is present in the posterior inferior relation. S3, that means splenic artery, suprarenal gland, and the splenic flexure is present. Okay. Kills, K for kidney, that is the left kidney is present. Patient, P for pancreas is present, and the mercilessly, that means mesocolon, that means transverse mesocolon is present. So this is the mnemonic. Okay. In anterior relation, in the right part of the stomach we will find the left lobe of the liver and the quadrate lobe near the pylorus. So near the pylorus there will be the quadrate lobe, and the whole left lobe of the liver lies in the anteriorly. So liver is just like this. So it is left lobe present in the anterior relation. Lower there is a anterior abdominal wall in the lower. So this is the anterior relation. Now stomach is surrounded by some peritoneal covering. From the lesser curvature to the liver there is a lesser omentum. From the greater curvature to the transverse colon there is greater omentum. So there is a lesser omentum and there is a greater omentum. From the lesser curvature, lesser omentum to the liver, from the greater curvature to the transverse colon there is a greater omentum. Now there are some ligaments also. So what are the ligaments? Gastrosplenic ligaments. So there is a spleen. So from the hilum of the spleen to the fundus there is a gastrosplenic ligament. From the fundus to the diaphragm there is a gastrophrenic ligament. So gastrosplenic ligament and gastrophrenic ligament is also present. Now what is gastric triangle? It is a surgical landmark where it is bounded laterally. The left is bounded by the costal margin. In the right side it is the inferior border of the liver, and in the inferiorly there is the transverse colon. So this is the gastric triangle, which is a surgical landmark. Okay, now coming to the arterial supply of the stomach. So what is the arterial supply? The main artery is the celiac trunk. So from the celiac trunk there is a splenic artery which goes to the spleen, hilum of the spleen, and from the splenic artery there is some short gastric artery. So these are the short gastric artery. Now one branch from the splenic artery which comes down and supplies the greater curvature of the stomach is the left gastroepiploic artery or left gastroomental artery. So it is left gastroepiploic artery. Another is from the celiac trunk there is a direct branch which is the left gastric artery. It also supplies another branch, that is the esophageal artery. Another from the hepatic artery proper there is one branch, that is the right gastric artery, and there is another branch, that is the gastroduodenal artery, which gives two branches, that is the superior duodenal artery, supraduodenal artery, retroduodenal artery, and the gastropancreatoduodenal artery, superior pancreatoduodenal artery. Another branch is the right gastroepiploic artery from the gastroduodenal artery. So this is the arterial supply of the stomach. Now coming to the nervous supply of the stomach. So sympathetic nervous plexus is from T6 to T10. So any pain in the stomach is referred in the T6 to T10 dermatome. So there is a epigastric pain. And parasympathetic supply, that is the gastric gland secretion, the acid secretions from the parietal cells are all from the vagus nerve. So there is an anterior vagus trunk, there is a posterior vagus trunk. From the anterior vagus trunk it supplies the nerve, that is the hepatic. One goes to the celiac trunk, another goes to the gastric nerve. Okay, so hepatic branch, gastric branch, and the celiac ganglion. So here is the ganglion produced. In the posterior there is a nerve to gracie which supplies the fundus, and there is a nerve to lateral jet which supplies the posterior wall of the stomach, that is the lesser curvature. And from the lung to lateral jet there is another branch to the celiac trunk. So this supplies the nervous supply to the stomach. Now coming to the lymphatic drainage. So lymphatic drainage, there is a, we have to divide the stomach into the left 1/3 and right 2/3, and the upper left 1/3 is again divided into upper 1/3, lower 2/3, and right 2/3 is divided into upper 2/3 and lower 1/3. Like this way, from here, from this part pancreato-splenic lymph node. From this part the lymph drainage to the lymphatic drainage is to the gastroepiploic group of lymph node. From here pyloric group of lymph node. Pyloric group of lymph node again drains into the hepatic group of lymph node to the celiac group of lymph node. From here the left gastric group of lymph node. From here right gastric group of lymph node, which again drains into the celiac group of lymph node. So this is the lymphatic drainage. And the venous drainage is the superior. This is the splenic vein is formed. Inferior mesenteric vein is directly goes into the splenic vein. So same as the arterial supply, the venous supply is the same name. So it supplies to the portal vein. So this is all about the stomach anatomy, gross anatomy of the stomach. Thank you.